guys, in this lesson we are going to be talking about sickle cell anemia. Okay, so sickle cell anemia is a hereditary disorder and it most often affects people of African or Mediterranean descent. And sickle cell is passed on as a recessive trait, and what that basically means is that both parents have to have the trait in order for one of their kids to have it. What's happening with this disease is that some of the red blood cells have hemoglobin on them that have the sickle cell trait. And you'll often see this written as hemoglobin S, and that S just stands for sickled. And when this particular hemoglobin that has that sickle trait is exposed to stress, so things like temperature or an infection and a fever or extreme exercise, they begin to harden and to change shape or to sickle. And you can see in the photo here what that actually looks like. So the sickled red blood cell changes shape and it becomes that kind of crescent moon or like a sickle. So when these red blood cells change and they become misshapen and rigid, two things happen. The first thing is that they have a decreased ability to carry oxygen. The second thing that happens is that these sickled cells are more likely to get stuck in the small vessels of the body, and we call that a microocclusion. And you can see in the photo here what that looks like. Those red blood cells are getting clumped up and not moving as freely through the vessels as they normally would. And like I said, this is called a microocclusion. And when this happens, it's extremely, extremely painful. And you'll see as we keep talking about this that pain is actually the number one symptom that patients complain of. So when a lot of cells become sickled and you get these clumps of cells gathering in areas, you get what's called a sickle cell crisis. And there are a couple of different types of these crises that can occur. So let's just take a second to look at a few of those. So the first kind of crisis is a vaso-occlusive crisis. And we kind of already talked about it on the previous slide, and you saw a photo of it. It's when the sickled cells are getting stuck in the small vessels. And what this does is it decreases blood flow to that particular area of the body, which results in hypoxia, which can eventually result in cellular death if we don't do something about it. The most common places that this will occur is in the extremities and in joints, but it can also happen in organs. And this is where I want to highlight one very serious complication that can occur, and that's acute chest syndrome. And essentially, this is when an occlusive crisis is happening in the chest. It is one of the most common complications, and it can have really poor outcomes. So it's really important to be aware of it and be on the lookout for it. It's usually associated with fever, increased respiratory rate and increased work of breathing, and chest pain. So it kind of looks like a pneumonia. So just make sure that you're aware if a patient's complaining of chest pain and they've got a fever, they need to be looked at immediately because they may need respiratory support and they may need blood transfusions. The second kind of crisis is when blood is pooling or gets trapped in certain areas of the body. And this is all because of the sickling. The blood is getting trapped in an area. And this is called a sequestration crisis. And the most common locations for this are in the spleen and the liver. And what this looks like for the patient is they just have a decreased amount of circulating blood. So they are hypovolemic. And if, again, we don't reverse it, this can turn into shock. So all really important things not to miss when you're assessing your patient who is in a sickle cell crisis. So we've already gone over most of the symptoms, but we'll just summarize them here really quickly. So the most obvious symptom and the one that patients will complain about the most is going to be the pain. Remember that those microocclusions and the lack of oxygen just really makes everything hurt. And so often what they say is that it just feels like the pain is all over. But it is also still really important to pay attention to their description of the pain because that can give you a really good clue about where their sickled cells are clumping up. So again, they may have chest pain. They may say that they have joint pain. So all of those things are going to be really important clues for you in terms of your management. The other symptoms that we're going to be expecting are symptoms that we would expect with any kind of anemia. So things like hypoxia, fatigue, and pallor. And last but not least, keep those complications that we mentioned earlier in mind when you're assessing. So be on the lookout for those things like fever, chest pain, difficulty breathing, and also signs of hypovolemia and shock. Management of an acute sickle cell crisis is actually pretty straightforward. And you can use the mnemonic HOP to help you remember what to do. So if you see a patient with symptoms of a sickle cell crisis, you need to hop to it and get them some fluids. So yeah, the first thing we're going to do is get those sickled red blood cells rehydrated and moving again. And that means we want this little guy here, we want it to look like that one. The second thing we're going to be doing is considering oxygen. If the patient's hypoxic, they should be placed on O2. And then, of course, you need to get them some pain medications. This is so important because the pain is so severe during a crisis. And this pain is on top of the chronic pain that they already live with every single day. And I know the opioid crisis is on everyone's mind right now, but it's so important to remember that pain is still what the patient says it is. And these kids are hurting a lot all of the time. So make sure you work with the patient, talk with them about what helps them feel better, and of course, still use your non-pharmacological methods to help with pain. Things like heat packs can actually be very, very helpful with these occlusions. Make sure you don't use ice packs because that actually can make the occlusions worse, but heat packs can be very, very helpful. But just know that they are going to need both NSAIDs and opioids to truly manage the type of pain they're experiencing. And remember, as with any patient that you see who lives with chronic pain, find out what a realistic goal for them is. When we're using the 0 to 10 pain scale, 0 is probably not something that we're going to be able to achieve. So speak with them about what number actually works for them. So the last two things I have listed here, antibiotics and hydroxyurea, are two drugs that are really important for the long-term management of sickle cell and hopefully presenting crisis. The sickle cell trait that we've been discussing makes people more prone to infection. And remember, stress and infection can actually cause a crisis. So these prophylactic antibiotics are used to help prevent this. Hydroxyurea is a newer drug that's been approved for adolescents and adult patients, and it's actually pretty cool. So what it does is hydroxyurea increases the amount of fetal hemoglobin that a patient has. And the interesting thing about fetal hemoglobin is that it doesn't sickle like a normal hemoglobin does. So by increasing the fetal hemoglobin in a patient, we're decreasing the number of hemoglobin that can actually sickle, reducing their chances of going into crisis. So definitely be on the lookout for these two medications specifically during your clinicals. When you're taking care of a patient with sickle cell anemia, your priority nursing concepts are going to be clotting, oxygenation, and comfort. Okay guys, let's recap and just highlight some key points for this lesson. So, number one, just remember that sickle cell anemia is a recessive hereditary disorder that causes misshapen red blood cells. These misshapen red blood cells can't carry oxygen the way that a normal red blood cell can, and they get stuck. When that happens, you end up with a sickle cell crisis. When a patient is in crisis, they are going to experience extreme pain, hypoxia, and lethargy. If you see a patient that has these symptoms and you know they have sickle cell anemia, what you're going to do is you're going to hop to it. And that means we're going to be giving fluids, we're going to be hydrating that patient, we're going to be giving oxygen if needed, and we're going to be giving them pain control. And last but not least, we're going to be monitoring these patients very closely for those complications that we mentioned earlier, like acute chest syndrome or stroke. That's it for our lesson on sickle cell anemia. Make sure you check out all of the really great resources that we have attached to this lesson, especially the video on what it's like to live with this disease. Now, go out and be your best self today, and as always, happy nursing.